Hello and welcome to the Rising Nurses Next Generation Nurses. In today's session, we are going to learn everything about ventilators from basic principle to advanced troubleshooting and nursing care. Let's get started. A ventilator is a life support device designed to help patients breathe when they cannot do so effectively on their own. It works mainly on the principle of positive pressure, pushing air into the lungs instead of relying on the natural negative pressure of normal breathing. Indications: we use ventilator in situations like respiratory failure, severe oxygen shortage, hypercapnia, after major surgeries, or in cases of neuromuscular weakness affecting breathing. Parameter parts of ventilators: every ventilator has key components: a power source, gas supply, a control unit to set modes and parameters, monitor to track patient status, and tubing deliver air to the patient. Mode of ventilation: we have invasive and non-invasive mode. Ventilators have various modes. In invasive ventilation, air is delivered via an endotracheal tube. With mode like volume control, pressure control, SMIV, and pressure support. Non-invasive modes uses masks such as CPAP and BiPAP for patients who can partially breathe on their own. Parameters: ventilator setting include tidal volume, positive and expiratory pressure or PEEP, fraction of inspired oxygen, respiratory rate, and the inspiratory to expiratory ratio. ABG-based adjustment: we often use ABG result to fine-tune ventilator settings. For example, if oxygen is low, we can increase FiO2 or PEEP. If carbon dioxide is high, we raise the respiratory rate or tidal volume. If carbon dioxide too low, we reduce them. Common alarms and troubleshooting. Alarms guide us potential problems. High pressure alarms may mean obstruction or patient coughing. Low pressure alarms often indicate leaks or disconnection. Apnea alarms require immediate checking for the patient effort. Mechanical ventilation can lead to complication like ventilator associated pneumonia, lung injury from pressure or volume, oxygen toxicity, and even reduced heart function also. Nurses responsibility: nurses play a vital role by continuously monitoring the patient and ventilator, keeping the airway clear, preventing infection, checking alarms, and educating the patient's family. Weaning process: gradually process of reducing ventilator support. Before starting, we ensure the patient is stable. ABG values are normal and secretion are minimal. Spontaneous breathing trials help test readiness. In summary, ventilators are life-saving devices that require careful mode selection, setting adjustment based on ABG results, and dedicated nursing care to ensure patient safety and recovery. Always remember that correct ventilators management and vigilant nursing support play a crucial role in improving patient outcomes. Thank you for joining this session on ventilators with the Rising Nurses Next Generation Nurses. Stay tuned for more nursing education videos. Thank you for watching.